I want to just tell you a little bit about how thyroid eye disease is a mimic in ophthalmology. And what I mean by that is it can end up in the other subspecialties within ophthalmology. And if someone has seen every subspecialist in your practice, if it's a multi-specialty group ophthalmology practice, you really should be thinking that thyroid eye disease might be a single unifying diagnosis. And the reason is, from the front to the back, including the orbit, thyroid eye disease can cause inflammation that can present to you in your subspecialty area. So if your area is cornea and anterior segment, the thyroid eye disease patient might say, I have a red eye. And that redness is usually over the insertion of the horizontal recti. But if you have a very particular location, the caruncular inflammation, so if we see the caruncular inflammation, that is very bothersome that it's thyroid. And so you know the caruncle is right here medially. So if we see the inflammation there or over the horizontal recti, that is the clue that this red eye might not be conjunctivitis or allergy, and it might be thyroid eye disease. If you're in the strabismus unit and you're dealing with pediatric ophthalmology and strabismus, the thyroid eye disease can be in the extraocular muscles and produce diplopia and ophthalmoplegia. As you know, the involvement is inferior, greater than medial, greater than superior, greater than lateral rectus. That is the order of the muscles that are involved. So it's like, I'm so lucky not to have thyroid, or some other mnemonic that you might have. It causes the big muscles, so the extraocular muscles are enlarged, because the glycosaminoglycans, the fibroblasts, the differentiation, all of the immunology that we've covered in different videos is making these muscles big. That produces the symptom of diplopia and the sign of ophthalmoplegia, usually hypotropia and esotropia, because it's a restricted pattern in the muscle involvement. You might end up seeing your glaucoma doctor. And the reason is, if you have all this stuff in the orbit is a closed box. And so if you put too much soft tissue into the orbit, the intraocular pressure will go up because the intraorbital pressure is going up. And that can look to you like open angle glaucoma, because you do a gonio and the angle is open, and you're going to think it's primary open angle glaucoma. But because primary open angle glaucoma doesn't cause strabismus or the red eye, that's the person you really should be thinking that maybe it's a secondary but open angle glaucoma. And so patients like this might have difficult to treat intraocular pressure, or they might have progression that's too rapid for glaucoma, or involvement of the wrong fibers. So as you know, in the optic nerve, the fibers involved in glaucoma are the temporal fibers, which are at the top and the bottom of the disc. So it causes vertical cupping and notching, and it doesn't like to involve the nasal fibers, which is the papillomacular bundle and the nasal fiber. So if we see temporal field defect or temporal pallor, you should be thinking maybe this glaucomatous cupping is from orbital disease, thyroid eye disease. The person also obviously could end up seeing the orbit doctor, because that same extraocular muscle enlargement is also affecting the fat. So when we have big muscle and big fat, you're going to get proptosis, chemosis. These are the orbital signs, and you might have the lid signs, lid retraction and lid lag. These are going to come to the orbit doctor and the oculoplastic service. And after all of this, you might end up with Neuro-Op. In Neuro-Op, they're going to be wondering, why is this person losing their vision? Why do they have such rapid glaucoma? Why do they have double vision? And the dangerous part of this is, they might come to Neuro-Op and they already had an MRI, which is negative, because we didn't image the right area. A negative MR of the head. So you can see how dangerous this thyroid eye disease can be as a mimic. So if a patient has seen cornea, strabismus, glaucoma, orbit, oculoplastics, and Neuro-Op, and has a negative MR of the head, but has a red eye, caruncular inflammation, diplopia, ophthalmoplegia, a bad glaucoma or a weird glaucoma, proptosis, lid findings, this is the time to be thinking that the thyroid eye disease is the mimic, if they've seen everybody in your clinic.